Chance fractures, fracture of the spinous process. These are flexion fractures of the spine first described by G.Q. Chance in 1948. Injuries: transverse fracture through the posterior elements of the vertebra, and the posterior portion of the vertebral body. Posterior portion of the vertebral body and the posterior elements. Okay. Less commonly, there is a compression injury to the anterior portion of the vertebral body because the vertebral bodies are relatively incompressible. Etiology: violent forward flexion, lap belt syndrome. Most common site is thoracolumbar junction, T12 to L2, and mid-lumbar region in pediatric population. This fracture initially became unknown as a seat belt injury due to its association with a sudden forward flexion that occurs when one is involved in a head-on automobile collision while being restrained by a lap belt. With the advent of both the lap and shoulder belt in 1980s, chance fracture have become less common, especially now that lap belt only. Seat belt have been almost entirely phased out. Up to 50% of chance fractures are associated with intra-abdominal injuries, lap belt aorta, seat belt aorta, pancreas, duodenum, and mesentery. Thank you. And also one picture. Nature has designed vertebral column on the lines of a modern beam, spinal beam. The spinous process, lamina and posterior elements and facets are posterior elements. Vertebral bodies and intervertebral disc are anterior elements. Excessive forward bending may cause a chance fracture in the posterior region. That is spinous process, lamina and posterior ligaments and facet. Especially as vertebral bodies are relatively incompressible. Thank you.